choice of equipment, it's time to speak of the probe. In my life, I have used only one type of probe. People say to me, one? The cardiac? I say, no, no, I will not use the cardiac probe because it can see the heart and only the heart. After, the resolution is pixelized, not very good.
Yes.
You use the vascular probe? I say, no, the vascular probe is, you mean the linear probe. I have a better example here, linear probe, but it's linear and we are not linear, so it does not make big sense for me. And among several defaults, it has a short range, and I want to see everything. And they say, so you use the abdominal probe? And I say, not really, because even if it has a good image quality and a sectorial field, it is much too large, uselessly, because I don't need the left and the right information. My field is focused. When I scan a heart, I have it here, the apex, and with the sectorial imaging, I have my full heart. I don't need to see what is left and right. When I scan the lung, I scan one intercostal space. If the abdominal probe shows me 3 instead of 1, okay, I am 3 times more intelligent. But when there are devices here, or the clavicular, or everything that can bother us, and when you scan a ventilated patient and you have to go posteriorly, this probe is a hindrance because of the ergonomics. So what do you use? And I use a very simple probe, which is, I try to find something that looks a bit like.
So while he's looking, I'm going to so in 2014, World Congress for Ultrasound and Medical Education was hosted by Oregon Health and Science University. And I spent a good hour going around to every different vendor trying to find what we need, which is our drumroll Microconvex, correct?
So you say the word microconvex, and I am a simple doctor.
Okay.
I am a simple doctor. And I see that neonatologists are interested to see the brain of the babies. They have no window. Yes, they have one very small window here, the fontanellar window. So they need a probe that can see through this window. A cardiac probe is not extensive, but a bit too linear to me. It should need to be a bit rounded.
So our classic phased array is flat here, and then I like to describe it as a piece of pie. It's coming out like a triangle, versus the convex is it's like a half circle almost, right? I mean,
the microconvex probe spouses, so to speak, the fontanellar approach, and then thanks to the sectorial imaging, we can see the whole of the brain, and we can see the superficie of the brain and the depth of the brain with a suitable resolution. So this probe exists, and when you take it, you just have to do this to take a microconvex probe. And I insist, a good one, because the manufacturers know how to make money. They are much better than me for making money, and some of them have built in the haste microconvex shapes of probes which do not have the requirements that surf needs for saving lives.
Okay.
Mainly the definition of a superficial limit and a deep limit. My probe is not 5 megahertz. You know why? Because I don't know what is a megahertz. Did you see in your life 1 megahertz? Never.
No, I don't.
What is the shape of a megahertz? On the opposite, you have seen centimeters, millimeters in your life. It's very simple. You buy a ruler, and I will not say that my probe comes to 17 centimeters. I will say that it begins from 0.6 centimeter up to 17. And this is how SURF defines a range.
Okay.
And
so that would be your range.
What we call the critical range means when you are, let us say, neonate apart and premature apart, when you have to deal with a critically ill organism, this is the range that we need. If we were only asked for putting venous lines, a probe with only 1 centimeter should fit, but not for all the rest. If you have an abdominal probe that shows beautifully the retroperitoneum, but lacks the first centimeter, or maybe 1 centimeter point 5, each time you will meet a patient a bit skinny, you will miss the pleural line and you will make mistakes. So what I say is completely logical, based on,
agree.
you know, how many hours of reflection, of a thought process? 100,000 hours. It's, you said the word love, if you remember,
Yes.
at the beginning.
Yes, love fulfilled.
And it is true that ultrasound is a bit of an obsession, maybe a bit of a work of a creation. And when somebody creates, you cannot stop him or her. And I devote, since the beginning, something like 8, 9, 10 hours a day, multiplied by 300 days a year, because we are human beings, we have families,
Yes.
holidays, and all in all, it makes a rapidly calculated 100,000 hours. So what I say can be taken into consideration. I talk with world experts. I say to them, you change your probes. It is good if you have time. In my patients, I have no time. It's good when your patients are clean, because if during an examination I change the probes, I will disseminate the microbes of the patient in areas of the machine that will be impossible to clean in a simple, logical, and fast way. So the speed is also, when you have finished your examination, I take a few seconds for making an efficient work of cleaning, because I have only one probe. And third, I speak to the world experts, and I say, and you are also wealthy, because you can buy 3 probes, and the probe is the most costly in the machine.
Yes, at least.
In addition, if I give one simple example, if you want to be sure that this young man has no pneumothorax or no longer pneumothorax after chest drain, if for any reason you want to scan this area that is the apical area of the lung, there is no probe for that. If you want to see the superior caval vein, the cardiac, the vascular, the abdominal will not work. So I have a probe which is really universal. They don't like to hear that, but I repeat it each time I can. This is the probe of the future. It will be used in 50 years for sure, and maybe 49.
We're rounding down.
I use it since 34 years. By providence, I was very lucky, because if I had begun with the traditional probes, I would not have seen the potential of this probe.
The whole cake.
And I make the cake. Look out, for me the cake is abdominal, venous, sinus, optic nerve, simple cardiac ultrasound. Here I don't speak of a cake, I keep the cake for the whole body ultrasound.
Okay.
But this definition of the material that we use, so I say to the manufacturers, you can hate me, because I advocate only one probe, but you can also be the one who will first
We'll do it.
make this machine for the whole planet, for the general practitioners, and you will be the winner.